Hi, my name is Dr. Mugdha. I work in Pace Hospital in High-Tech City, Hyderabad as an obstetrician and gynecologist. So today I am here to talk about what is vaginal discharge. Vaginal discharge is a fluid secreted by the cervix and vagina. It contains bacteria and dead cells. So it protects the vagina by lubricating it, maintaining its pH. Also, it moistens the vagina and keep clean. In a way, vaginal discharge is a way of body to respond to any hormones that is secreted in the body, and thus it is also a mechanism of protecting the vagina from various different diseases. Having a vaginal discharge is absolutely normal until and unless it is associated with any itching or pain or any foul smell. Usually, vaginal discharge changes in order as well as in consistency during the menstrual cycle. From 1st to 5th day when you are menstruating, it is bloody or dark brown in color. Then from 6th day to 14th day, it becomes clearer and becomes thinner in consistency. Usually during ovulation or nearing the ovulation, it becomes thicker and egg white or slippery in consistency. This is how the women assess their menstrual cycle, and they know that they are ovulating during this period. After ovulation, usually it again starts becoming lesser in quantity as well as it becomes thicker. That is from 25th to 28 days when you are about to get your menses again. At that time, it will be little whitish in color with lumps like clumpy. First, if it is curdy white in color or chunky, usually odorless, it happens usually in yeast infection, in which there is little pain or irritation or swelling around the vagina. Then grayish or whitish in color, usually having fishy smell. That happens in bacterial vaginosis. It also has some pain or irritation around the vagina. Painful sex is there. Other like yellowish or greenish in color with foul smell. It happens in trichomoniasis. Trichomoniasis is usually a sexually transmitted disease. In this also there will be some inflammation around the vagina. Then viral diseases like herpes or syphilis might also have some vaginal discharge, but in herpes there will be some blisters or vesicles with ulcers, and in herpes ulcers will be painful, whereas in syphilis the ulcers will not be painful. Then pinkish vaginal discharge, it happens usually around ovulation or during implantation, or if some IUCD is in situ, at that time also pinkish vaginal discharge might happen. The last one is brownish or bloody vaginal discharge. That usually happens when there is cervical irritation. It can happen during some precancerous conditions, some endometrial cancers, or any other postmenopausal bleeding, or any hormonal imbalances, which is usually associated with intermenstrual spottings and all such conditions. Usually, patient presents us with some symptoms, and following that, we do a per speculum and per vaginal examination. And following this, some blood test or some test can be carried out to come to the conclusion. Usually, these patients will have some associated complaints or issues associated. Like for example, patients presenting symptoms like yeast infection might be associated with prolonged use of some antibiotics or some birth control pills, or might have diabetes. Then patients associated with bacterial vaginosis might be having multiple sexual partners, or might be smoking, or doing vaginal douching a lot, or trichomoniasis and gonorrhea are usually sexually transmitted. Trichomoniasis can also be transmitted by using public swimming pools or sharing bath towels or bathing suits and all. So accordingly, we do some tests, like we do pap smear to check if there is any cancers like cervical or endometrial cancer or any cancerous tissue that might be there around the cervix. And then we do a high vaginal swab in which we come to the diagnosis if there is gonorrheal growth, or also check for blood sugars, and if they are presenting with vesicles or ulcers, then we check for herpes virus infection in the blood, and accordingly we come to the diagnosis. So first of all, using a loose cotton panty and using panty liners whenever necessary, keeping your vagina dry and clean, or using a wash mild soap in only once in a day, not using too much of vaginal washes. Usually people have this myth of using vaginal wash a lot and every day, which might alter their pH and finally end up having more of vaginal discharge and making yourself prone to more of these diseases. Like, vagina is a vagina and it should smell like vagina and not like a fruit or flower. Also including pre-probiotic in your food like buttermilk, curd, using more of fresh fruits and vegetables, drinking plenty of water. If also after this, if you feel like you are having regularly or repeatedly vaginal discharge, you should get your partner tested too. So having a normal vaginal discharge is absolutely normal. It's your body's way of reacting to the hormones in your body, and it's your body's way of keeping your vagina clean and healthy.